Good job.
They didn't hear about the trick.
You should play
Hey,
my car
Ray.
or something.
I'm gonna be home tomorrow.
I'm all done yesterday.
Hey, how do you like how we Shannon?
I think this is better.
I think it should get some more space.
Yeah.
There's not so much stuff behind you.
Oh no, I had to do this again.
Right, that's enough.
What will you do when your organs when you die? There's only two options. Keep them or donate them. Most people do not want to contemplate their own demise, and that may be a reason for the lack of organ donations post-mortem. There is a definite need for organ donors, and that need grossly outweighs the amount of donations available. Major organs that can be donated include the heart, kidneys, liver, and lungs. Some of the causes for needing a heart transplant include ventricular arrhythmism, abnormal or irregular heartbeat may require a transplant if not controlled by medication. Coronary artery disease, fatty deposits obstruct blood flow to the heart, congenital defects, and heart disease. Heart fails to pump blood to the rest of the body. Some of the causes for needing a kidney transplant: diabetes. Continuous high blood sugar can cause damage to the kidneys. Polycystic kidney disease, genetic disorder, protruding cyst in the kidneys leading to renal failure. And high blood pressure can hinder kidneys from performing their needed functions. Some of the causes for a liver transplant: alcohol liver disease. Excessive alcohol use over a prolonged period can cause damage to the liver. Chronic viral hepatitis. The virus that causes hepatitis can slowly damage the liver over a period of several years, eventually leading to the point of liver inflammation, and then to a type of permanent scarring known as cirrhosis. Autoimmune hepatitis, a malfunction of the immune system that causes damage to the liver tissue. Hepatic tumors. They are malignant tumors found in the liver and are the result of the activity of cancerous cells. Acute liver failure. This typically comes from a virus or as a result of ingesting some type of poisonous substance. Biliary atresia, a disease of the liver and bile ducts that occurs in infants. Some causes for needing a lung transplant. Cystic fibrosis. This is a genetic disease that causes the natural mucus in the lungs to become abnormally thick, which leads to the blockage of airways as well as increased bacterial infections in the lungs. Chronic obstructive pulmonary disease, also known as COPD, a condition that affects the person's ability to exhale air completely out of their lungs. Smoking is one of the most common causes of COPD. Pulmonary hypertension, high blood pressure in the lungs that hinders the free flow of oxygen. Emphysema, the deterioration or loss of lung tissue or the formation of cysts in the lungs. Emphysema is most often caused by smoking, but it can be developed via a genetic disorder as well. Some statistics involving the organ donation and transplants. According to the U.S. government information on organ donation and transplantation, as of August 2017, over 114,000 men, women, and children were on the National Transplant Waiting List. 34,770 transplants were performed that year. 20 people die each day waiting for a transplant. Every 10 minutes, another person is added to the waiting list. One person can donate up to 8 life-saving organs, which include the heart, 2 lungs, liver, pancreas, 2 kidneys, and intestines. Tissues can also be donated, which include corneas, skin, veins, heart valves, tendons, ligaments, and bones. A living donor can donate a kidney, part of a liver, lung, intestine, blood, and a bone marrow. There's a lot of myths and misconceptions that go along with organ donation. And according to the American Transplant Foundation, one myth is having a medical condition disqualifies you from organ donation. The fact is, anyone regardless of age or medical history can be a donor. The transplant team will determine at an individual's time of death whether donation is possible. There are very few conditions that would prevent a person from becoming a donor, such as HIV infection, active cancer, or a systematic infection. You should still consider registering. Even with an illness, you may be able to donate your organs or tissues. The next myth, a person's religion does not support organ donation. The fact is, most major religions in the United States support organ donation and consider donation as a final act of love and generosity towards others. Myth, if I'm a donor, medical personnel will not try to save my life in an emergency. Fact is, when you are sick and admitted to a hospital, your life is the #1 priority. Donation does not become an option until all life-saving possibilities have been exhausted. Myth, a family won't be able to have an open casket if I'm an organ donor. The fact is, an open casket funeral is usually possible for organ, eye, and tissue donors. Through the entire donation process, the body is treated with care, respect, and dignity. The need versus donation is grossly outweighed. So how can we persuade others to donate? There are many misconceptions about the way in which organ donation works. Providing more educational opportunities could persuade others towards organ donation. Some possible incentives. Although controversial, some have suggested the possibility of offering incentives for organ donations. Unfortunately, we cannot rely on altruism alone to procure that much needed donation. Some argue that incentives would corrupt humanity. By placing a material value on human organs, we diminish human dignity. But how is it dignified to allow someone to die because they are only allowed to receive a life-saving organ from a person who gave it freely? Freely given or compensated, organ donation is a gift of life. Now that we have learned about why people may need transplants, statistics regarding the need for donations, debunked myths, and thought of some ways to persuade others to donate, I hope that you feel confident enough in making an educated decision to register as an organ donor. If you're interested in saving lives, you can easily register online at donatelifetn.org.
We are.
Good job. Good job.
Yeah, we're.
I don't know if they're alone in